Leave them alone. What can you do to get your blood pressure down when medicine does not bring it down where it should be? Good evening and thanks. Well, Lena, the medicine usually can do it. If it does not, there are other things that need to be evaluated, such as sleep apnea. Obstructive sleep apnea, where you are basically choking when you're trying to sleep and breathe, is one of the causes of uncontrolled high blood pressure. There are also a couple of neurohormonal secreting tumors that are attached to your kidneys that can do it, called a pheochromocytoma. That is one of the issues as well. Being overweight again can negatively impact your blood pressure. But for most people, the problem is that they're being undertreated. For to control a usual case of blood pressure is going to require at least at least three blood pressure medications. Fortunately, there are combination pills that have three drugs in one pill, so your actual pill burden is less. But if you also are challenged with high blood pressure, high cholesterol, and diabetes, you have the trifecta. You have what's called the metabolic syndrome, and you have to control and treat each of those disease processes aggressively and enthusiastically. You can't say, well, I'm going to work on my blood pressure first, then I'm going to work on my cholesterol, then I'm going to work on my blood sugar, or any order thereof. You have to control each and every one of those disease states to control all of them maximally. If you don't control one of them, you're going to have difficulty controlling all of them. So it's very important that you and your healthcare provider make an agreement that you're going to work on all three of these things each and every time you come to the doctor's office. If you're going to a doctor's office where they say, "Oh, we're only going to deal with one thing," and you'll have to come back and be rescheduled for another, technically the metabolic syndrome is one thing. It is one disease state that's manifesting itself three different ways: high blood pressure, diabetes, and high cholesterol. So that needs to be addressed, and it needs to be addressed aggressively. But if you're not on at least three medications, then you're being undertreated. Some people require 5, 6 medications. Some people require 7 medications. It's however many it takes to control your blood pressure. Because if your blood pressure is not controlled, you start doing damage to your kidneys. You start to lose renal function, which makes it more difficult to control your blood pressure. And it's the road and pathway to complete renal failure and being on dialysis. Number one cause of dialysis: uncontrolled high blood pressure. Particularly if you also have diabetes. So very important that your physician not be shy and that you be accepting of the need. Don't think it's a treatment failure if your doctor has to add another medication, because it is better to take multiple meds at lower doses than it is to take fewer medications at high doses, because high doses of antihypertensive medications are associated with an increase in side effects. Whereas if you only have lower doses of multiple medications, your side effect profile should be minimal. You should not have to suffer controlling your blood pressure. You shouldn't be lightheaded. You shouldn't be dizzy. You shouldn't have blurred vision. Men, you should not have erectile dysfunction. There are medications that will lower your blood pressure. They will not negatively impact your sexual function. And so that is what Dr. Kaya uses in his practice. I would never put a man on a medicine that takes the lead out of his pencil, because I wouldn't take it if it was me. So that's just particularly when there are other options to do it. But you have to understand the guidelines, the hypertensive treatment guidelines start off. The very first drug is one that can cause erectile dysfunction. So you have to be very conscientious about that.